Hello everyone, we are Group 2 and today we'll present about maple syrup urine disease MSUD. Let's get started. Have you ever wondered what is maple syrup urine disease? MSUD is an autosomal recessive condition characterized by a disturbance in the normal activity of the branch-chain ketoacid dehydrogenase complex. This complex is responsible for the breakdown of branch-chain amino acids, which are leucine, isoleucine, and valine. Even though MSUD is rare, it is a serious hereditary disorder. It impacts both males and females equally. It is also estimated that one incidence occurs in every 185,000 live births worldwide. Next, we move to etiology of MSUD. MSUD is usually caused by mutations in one of the three genes, BCKDHA, BCKDHB, and DBT, which represent the E1, E2, and E3 subunits of the branch-chain ketoacid dehydrogenase complex. Mutations in three genes result in decreased or no enzyme activity. In addition, it results in an accumulation of branch-chain amino acid in the plasma and corresponding branch-chain ketoacid in the urine. Now let's move to the pathophysiology of MSUD. MSUD has four categories based on age at onset, severity of symptoms, response to thiamine supplementation, and biochemical findings. Firstly is classic, which is the most severe types of MSUD and present during neonatal. The symptoms may appear 3 days after birth. For intermediate stage, it is less severe than classic. The symptoms emerge in children between 5 months to 7 years old. Next, intermittent stage. They undergo normal growth and neurological development. However, during catabolic stages, they have the same clinical and biochemical characteristic as the classic stage. Lastly is thiamine responsive that needs a restricted diet and large dose of thiamine. These are the symptoms of classic and intermediate MSUD. Both have maple syrup odor of cerumen in urine and having poor feeding. In the classic stage of symptoms include lack of energy, having abnormal posture, focal dystonia, and stereotype movement. However, the intermediate stage faces poor growth and developmental delay. They also may develop severe leucinosis and brain swelling if faced with enough catabolic stress. Compared to the other stages, intermittent will undergo normal early growth and development throughout infancy and early childhood, but they will lose physiological or psychological compensation that can be severe. For thiamine responsive, they share the same symptoms like intermediate stages. The diagnosis of MSUD consists of elevated urine level of branch-chain ketoacid, pyruvate, and lactate, elevated of plasma level of branch-chain amino acid. Moreover, doctor also can do the detection of allo-isoleucine and 2-oxo-3-methyl-valeric acid with high-performance liquid chemotherapy (HPLC). Other than that, MSUD can diagnose by newborn screening as well. A small amount of blood will be collected from the baby's heel. It will measure the amount of some amino acid in the blood. A high level of amino acid leucine suggests that the baby may have MSUD. Now let's continue to the management of medical, nutrition, and lifestyle. For the medical management, first, immediate medical intervention to reduce blood levels of branch-chain amino acid, particularly leucine. In some cases, patients may require hemodialysis or hemofiltration to remove waste, certain fluids, and specific amino acid from the blood. Second, controlling the level of amino acid of leucine, isoleucine, and valine in the patient's body to make sure the amino acid do not exceed person's tolerant level and begin to cause harm. When patient with MSUD gets sick or fever, or when amino acid rise to a dangerous level, the patient must be hospitalized immediately. In the hospital, doctors may give glucose and insulin through a vein, use an IV or nasogastric feeding tube, hemofiltration or dialysis, or monitor the patient for signs of brain swelling or infection and acid buildup. Next, liver transplant. In rare cases, liver transplantation has been used to treat individuals with classic MSUD. A healthy transplanted liver can supply enough enzyme to break down the three affected branch amino acid, allowing individuals to live symptom-free, eat normal food, and avoid further cognitive problems. Even though patients will have to take medicine to suppress the immune system for the rest of their life to stop their body from rejecting the new liver. For the nutrition management, a low diet protein is essential among MSUD in order to reduce and control the amount of particular amino acid, specifically leucine, isoleucine, and valine in the body. Managing nutrition for MSUD is by controlling and maintaining plasma branch change amino acid concentration in the normal treatment range. Blood sample tests are important to observe the effectiveness of treatment to the level of branch change amino acid. The result of the blood tests also are used to adjust the diet. Next, mother can breastfeed her baby and keep the blood leucine, isoleucine, and valine at an acceptable level. However, breast milk alone contains too much of leucine, isoleucine, and valine for babies with MSUD. Therefore, MSUD infant formula needs to be given in addition to breast milk. The baby will be given leucine, isoleucine, and valine-free formula instead of breastfeed or standard infant formula for the first few days after diagnosis until they are 17 to 26 weeks of age. Also, the mother should record the baby's intake to observe their feeding pattern. Any herbal or medicine teas or baby chews are highly avoided for infants. Also, extra vitamins and minerals are not needed except for vitamin D. Now let's move to lifestyle management. People with MSUD can grow into adulthood by following a strict diet and avoiding illness and stress as much as they can. The special low-protein diet is to reduce the amount of three amino acids called leucine, valine, and isoleucine. Second, provide hydration and calorific support. Calorific support is crucial to supporting protein anabolism. The next lifestyle management is by exercise and sport. Having MSUD does not limit their ability to participate in exercise or sport. The Irish recommendations for exercise are moderate activity for at least 60 minutes every day for teenagers, for example, cycling, running, brisk walking. Provided here the tips for exercising safely with MSUD. The last lifestyle management is by dental care. Suggestions for reducing dental problems include finish your synthetic problem in one go, drinking the synthetic protein in a straw, and give some water after each synthetic protein. The last part is diet suggestion for MSUD. People with MSUD have to follow a strict low-protein diet by controlling the amount of the three amino acids. For the MSUD diet, low-protein food can be eaten freely. Examples are fruits, vegetables, butter, sugar, and honey. Some specially manufactured low-protein foods are available such as bread, rice, milk, and chocolate. Also, some food can be eaten in measured amount called exchange food. Example are rice, bean, peas, and potatoes. Every child will have a set number of exchanges per day depending on their leucine level. All high protein, leucine, isoleucine, and valine foods should be avoided such as dairy products, meat, fish, and nuts. However, there are suitable low-protein alternatives available for these foods. Breastfeeding mothers do not need to alter their diet in any way if their baby has MSUD. During this time, they should get enough food and drink, eat healthy food, and limit tea, coffee, and fizzy drink intake. When infant can eat solid food, breast milk or regular infant formula will be removed from the diet and the branch change amino acid will come from foods. Isoleucine and valine supplements are also recommended to keep blood levels of isoleucine and valine in the correct range to keep away the toxic leucine from the brain. Here, some examples of low-protein meals. These are all the references we use in this video. That's all from us. Thank you for watching.